talking health, this time around from Ogun State. A professor of medical parasitology, Abimbola Amo, says Nigeria will require 420 billion naira and political will to eradicate the scourge of malaria through total fumigation of the country against mosquitoes on or before the year 2030. Amo suggested that the 420 billion naira should be sourced through introduction of mosquito responsibility tax of $1 monthly from every adult Nigerian for use in surveillance, biological control and chemical control of mosquitoes, as well as for interagency cooperation and research on mosquitoes. The professor of medical parasitology made this known while delivering the 92nd inaugural lecture of the Olabisi Onabanjo University Agoiwoye. And she said the scourge of malaria caused by a parasite from the female Anopheles mosquito is a huge health burden in the country. According to him, malaria is responsible for the increasing hospital visits, hospital admission, anemia during pregnancy, school absenteeism among children, and even deaths. He noted that the treatment of people with malaria and use of insecticide-treated mosquito nets have provided inadequate and been ineffective in eradicating malaria, hence the need to attack the causative organism by destruction of mosquitoes. He called on the local, state and federal governments to enforce the Mosquito Destruction Law of April 1945 and 1979 across the country, saying if his suggestions are adopted with political will, malaria would not only be wiped out of Nigeria but also create jobs for Nigerians. Explaining further in his lecture titled Parasite of Animals and Man, A Dance in the Forest of Death, he said laws which were enacted in 1945 in the Southern Protectorate and Oyo in 1979 authorized the destruction of mosquitoes with legal notice for the appointment of sanitary inspectors.
Yes, Florida's climate is like Nigeria's climate, and they have a lot of mosquitoes, but they kill mosquitoes every day. And there are people working 24 hours killing mosquitoes. We used to have sanitary inspectors in those days. Wole wole, that was what they were doing. So why don't we go back to that side? Do you understand? Yeah. If we go back, then we will control malaria.
Director General of the National Emergency Management Agency